there's a lot of interest in dual targeting of the HER2 receptor. So currently trastuzumab, which is the monoclonal HER2 body, is the antibody, is the FDA approved therapy for breast cancer. There are other therapies as well, such as lapatinib, TDM1, pertuzumab, but all of those have been approved in metastatic breast cancer. Neoadjuvant trials have suggested that combination of these therapies, so trastuzumab with lapatinib or trastuzumab with pertuzumab, can increase the effectiveness as compared to a single agent alone, but these have not been FDA approved. So we did a general systematic review to look at all the trials and see if dual targeting of the HER2 receptor would be better than single targeting. So when we looked at all the clinical trials that have been conducted in the neoadjuvant settings, we found that dual targeting of HER2 receptor clearly is better than single targeting, and this resulted in improvement in pathological complete remission as compared to single therapy alone. We then looked at the impact of this on survival, so the impact of pathological complete remission on survival, and found that presence of a PCR correlated with increased disease-free survival and overall survival as well. We then looked at subtypes, the hormone receptor positive and hormone receptor negative subtypes, and found that this was true for both, suggesting that dual targeting of the HER2 receptor can increase the chances of PCR and potentially improved outcomes. We also looked at the rate of breast conservation therapy, and interestingly, we didn't see any difference in the rate of breast conservation therapy with dual targeting versus single targeting of the HER2 receptor. And then if you look at the trastuzumab story, you also see a similar trend. So trastuzumab in combination with chemotherapy clearly improves the pathological complete response as compared to chemotherapy alone, but the clinical trials have failed to show that it actually improves breast conservation rate as compared to single agent. And it talks about the various factors that go into breast conservation versus mastectomy decision, the patient-derived factors, their choice, as well as the surgeon factors.